live on Masti AVI right now. हमारा चल रहा है cooking show which is called Cooking Comes Alive, the only show of its kind across Southeast Asia जहाँ पर रेडियो स्टूडियो से लाइव हम किचन के अंदर घुसते हैं और लाइव खाना बनाते हैं.
पहला अगर आपका स्वागत करता हूँ सिंगापुर रेडियो मस्ती 24/7 लाइव की वो महफिल जिसे आप थ्रोबैक थर्सडे कहते हैं.
रेडियो मस्ती 24/7 पर आप हमें दिल की आंखों से देखते हैं, लेकिन मस्ती एवीआई पर हम भी आपको देखते हैं और छेड़ते हैं. Best of audio and visual entertainment. Games, star interviews, contests, full on masti.
Masti AVI.
Masti AVI.
Masti AVI. Masti AVI. Follow us on Radio Masti 24/7 live Singapore Facebook page and watch all shows on Masti AVI tab on our app Radio Masti 24/7. Masti AVI, meaningful entertainment at your fingertips. Brought to you exclusively by Radio Masti 24/7.
Welcome, Radio Masti 24/7 and this is Masti Media Network and of course a very special feature. मेरा नाम रेणुका है और आप में से जितने लोग मुझे जानते हैं, well good on you. अगर नहीं जानते हैं तो well पूछूंगी मैं, क्यों नहीं जानते हो, कहाँ रह गए पिछले 10 साल. Well I hope there's nobody like that. But guys I'm very excited. हर साल एक ऐसा टॉपिक होता है World Mental Health Day पर, जो कि मुझे लगता है is absolutely very close to my heart. But at the same time, the more important thing is with the growing awareness or lack of it, which is the mental health and wellness, बड़ा जरूरी हो गया आजकल बात करना. And when I say बात करना, that means that you and I must openly talk about the importance of physical as well as mental wellness. उसका जो हेल्थ है, हमारा जो माइंड है, वो कितना हमारे कंट्रोल में है, कितना हम अपने माइंड को हेल्दी रखते हैं, as much as we bother in exercise and we make sure that we are physically fit, right? एक बड़ी ही पॉपुलर सी लाइन आई थी एक टाइम पर जिसको हम कहते थे it's okay not to be okay. Have you heard that? Well, I hope you have, because हम कई बार सोचते थे कि यार how can I go and tell people that I am mentally not feeling in control? How can I talk to people and say that नहीं यार something is not right somewhere, right? Because हमें हमेशा ये लगता है कि जो mentally थोड़े से परेशान लोग होते हैं ना, in very loose terms we sometimes say पागल है, you know. But that word itself in the new age means a lot more than just a casual remark. So guys, be very careful. Be very careful about what you say to people. Be very careful when you say this person's mind is a little hila hua or something like that, because this can mean real big stuff in today's world. लेकिन serious बातें नहीं करेंगे. मैं आई हूँ तो obviously कुछ ना कुछ लाइट वाली कॉन्वर्सेशन होगी, लेकिन मीनिंगफुल होगी, है ना सलमा? गुड इवनिंग, हाउ आर यू? एंड एक तरफ अंतरा, जी हाँ, आरजे अंतरा का शो चल रहा है, विच इज मस्ती वॉइस आपकी चॉइस ऑन रेडियो मस्ती 24/7, और दूसरी तरफ रेणुका का ये बड़ा ही इंपॉर्टेंट शो चल रहा है जो कि आपकी मेंटल हेल्थ के बारे में बात करने वाला है. एंड आई हैव नॉट गॉट जस्ट वन और टू, बट आई हैव गॉट 3 अमेजिंग पैनलिस्ट टुडे एंड आई एम गोइंग टू बी ब्रिंगिंग देम एक एक करके यहाँ पर. आप हैरान हो जाएंगे उनके क्रेडेंशियल से, आई प्रॉमिस यू दैट. All right. So, chaliye, without further ado, what I'm going to do is I'm going to bring my first panelist on the screen now, and her name is Dr. Mahima Sahi. Dr. Mahima Sahi जो हैं वो डायरेक्टर हैं Embrace Lives की, और इस समय जुड़ रही हैं चंडीगढ़ से हमारे साथ. क्लिनिकल साइकोलॉजिस्ट हैं और साथ ही साथ में 8 साल से ऊपर का उनका एक्सपीरियंस है. सो किस चीज में है, क्या है, लेट मी जस्ट ब्रिंग हर हियर एंड यू आर फ्री टू आस्क हर. Hi, Mahima.
Hi.
How are you?
Hi, Renuka. Thanks for having me. I'm amazing.
So, इतना formal, क्या हो गया?
No, I'm really happy to be a part of this show. I think there is more and more dialogue required around mental health, and I'm so glad you're taking the onus of doing it this Mental Health Day. So really excited to be a part of this. Thank you for having me.
थैंक यू सो मच। सो महिमा, आपके साथ में हमारे बड़े ही एक स्पेशल और भी हमारे यहाँ पर पैनलिस्ट हैं, और मैंने सुना है कि आपको नहीं पता था दैट ही इज गोइंग टू बी हियर एंड यू गाइस हैपन टू नो ईच अदर फ्रॉम द पास्ट, सो आई एम गोइंग टू बी इनवाइटिंग हियर अंकित, एंड अंकित इज वेरी पैशनेट अबाउट मेकिंग अ पॉजिटिव इम्पैक्ट ऑन पीपल्स लाइव्स, एंड एक मेंटल हेल्थ केयर सेटअप उन्होंने फाइंड किया था, एंड इट्स कॉल्ड हे, HEYY, एंड ऑफ कोर्स उसी के साथ साथ ही इज बीन हेल्पिंग 200,000 से भी ज्यादा यूजर्स टू इम्प्रूव देयर वेलबीइंग, एंड काफी ज्यादा ऐप स्टोर पे हाई रेटेड है, मैंने सुना है। खैर, बात करते हैं अंकित से और देखते हैं कि अंकित, हे अंकित, व्हाट्स गोइंग ऑन?
Hey, Renuka. See, it really catches on, right? The name really
Yeah,
catches on.
it does. I have to admit, it definitely does. So, Ankit, from a corporate leader's position to hey, what is this transition all about?
Yeah, I never saw it coming, but I think when I look back to my own journey, I back in 2019, 2020, I was actually going through a rough patch, and
Mhm.
I had a help of a coach that time. So it was almost like about 7 to 8 months of constant conversation with him, that I went through.
Okay.
And that was also coincidentally, it was the time जब मैं खुद भी एक startup start करने की कोशिश कर रहा था, and so I think ये all the dots kind of connected together,
Mm.
and really saw a need in the space कि how do we impact mental well-being of people in a positive way. So it kind of all came together, and yeah, I mean, from my e-commerce business background, I kind of ventured into this. Yeah,
Wow. Wow,
yeah.
wonderful, beautiful journey. And I must say, it's very, very important for the social fabric today, right? हमारी society को बहुत ज़रूरत है. And guys, last but absolutely not the least, I can tell you, is somebody I am a big fan of. आप भी उनसे पिछले साल मिले थे जब वर्ल्ड मेंटल हेल्थ डे पर डॉक्टर सुषमा चावला हमारे साथ में जुड़ी थी, और उन्होंने हमसे डिमेंशिया के बारे में बहुत बढ़िया सी बातें करी थी. बढ़िया मतलब इतनी नॉलेज, इतना एक्सपीरियंस, एंड इट वाज सो हेल्पफुल for all our listeners. So I'm going to invite Dr. Sushma Chawla here right away. Dr. Sushma, welcome.
Thank you. Thank you, Anita.
कैसी हैं आप, ये बताइए.
I think I spelled it wrong.
कोई नहीं, रेणुका है, अंकिता बोल दिया, एक ही बात, फर्क नहीं पड़ता. How are you? Tell me, Dr. Sushma, कैसी हैं आप?
I'm good. And thank you so much for inviting me on this platform again, on this
नहीं,
day.
I
I
know.
hope we are able to learn from each other, and people can learn from us.
That is absolutely the idea. कहते हैं ना कि एक्सपीरियंस और डिजिटलाइजेशन, ये दोनों चीजें जब साथ में मिल जाती हैं तो इट कैन एक्चुअली डू वंडर्स. सो ऑन वन
Yes,
साइड वी हैव एक्सपीरियंस,
can.
ऑफ कोर्स, विद
It
यू, ऑल ऑफ यू रादर, बट एक्सपीरियंस डॉक्टर सुषमा का जो है, और साथ ही साथ में मेरे साथ जो डॉक्टर महिमा और साथ में अंकित हैं, आई थिंक टुगेदर दिस शो कैन बी ऑफ ह्यूज रेलेवेंस. सो गाइज, मैं आगे बढ़ने से पहले एक बार डॉक्टर सुषमा से उनकी एक जरा स्टोरी एक बार फिर से सुनना चाहूंगी कि डॉक्टर सुषमा, आपने जब अपना MBBS किया था and you decided to be a doctor, at that time did you think that many years down the line you will actually be working dementia with dignity, dealing dementia with dignity, and that is the focus?
No.
कैसे हुआ ये सब?
When I finished my medical studies,
जी.
I was the first one to decided to be the first one to leave the country and go to US, because at that age, in 1973 there was a mass exodus of doctors to US. Well, I stayed back, and destiny had its own hand to play, and I practiced all my life in the field of gynecology and obstetrics, bringing new babies into the world. And it was only in 1994, when I was myself around 44,
जी.
I never knew that what is coming in front of me. It was the accidental encounter with a dreaded disease called Alzheimer's disease, which is the most common form of dementia. And dementia means people say that it is memory loss. Alzheimer's also they say it is memory loss. और कई ब्लंट लोग तो कह देते हैं कि पागल हो गए हैं ये तो,
Exactly.
और
That's what I
थोड़े से
said.
सोफिस्टिकेटेड होते हैं तो कहते हैं सठिया गए हैं ये. And I was caring for my mother, and in 1994 I didn't even know D of dementia. And I didn't know what was happening to my mom. Is she really acting, or is she really having some problems? You know,
जी.
and like sometimes she used to say, "मुझे खाने को कुछ नहीं मिला," whereas the helper used to say कि इनको पूरा खाना खिलाया है, which I
हाँ.
never used to believe. वो तो मुझे साल बाद पता चला कि उन्होंने पूरा खाना खाया है, डबल भी खाया है, जब उनका वेट गेन होने लग पड़ा, जो कि उनका सारी जिंदगी कभी नहीं हुआ. She was a slim and trim, well-maintained lady. तो वहां मुझे लगा कि ये खाना ज्यादा खा रही है इसलिए वेट गेन हो रहा है. लेकिन it was not a smooth journey. Getting perplexed कि what is happening to my active mother. Well, after 5 years, she expired. And again, it was, I was just mourning her death and trying to adjust myself. And then again, there was a chance encounter with print media,
अच्छा.
where my whole journey was published. And believe me, Renuka, in one day, more than 269 people contacted me. And they had the same story. I never knew in my dreams also कि इतने लोगों को प्रॉब्लम्स हो सकती है. हम तो अपने के लिए ही रो रहे थे कि हमें क्या हो गया, we were just groping in the dark.
जी.
And after meeting each one of them, taking 1 year, the problem was only one basic problem: lack of awareness. So there I decided that let me try to create awareness about this disease. That was my first mission. And along with my other friends, colleagues, and volunteers, I
जी.
started doing memory camps,
अच्छा.
where I was giving awareness about dementia and Alzheimer's. Basically, on my own experience, कि भाई ऐसा हो तो इसको छोड़ना नहीं, don't take it lightly. It can be Alzheimer's. And slowly, abhi tak to I think I've done thousands of camps and awareness talks. That was needed at every level, even at schools, ladies club, senior citizens club, because why schools? वहां तो सारे youngsters हैं, teachers भी young हैं, and this is a
Yes.
disease normally old age people. मैंने एक घर में देखा था कि one child was very upset because he saw his mother working so hard to take care of his grandparents, and the grandfather was always abusing her and trying to soil the room. And that little child was really tortured, and he consulted a counselor in his school कि
अच्छा.
मुझे तो घर में बहुत प्रेशर है, मेरी मम्मी इतना काम करती है, बट फिर भी मेरे दादा उसको बहुत गालियां निकालते हैं. When he heard about this disease, he immediately went home, talked to his father and mother, and said, let us take Dada to the neurologist. And there the advanced dementia was diagnosed. So that was one mission fulfilled, that why I started doing it in schools. Even
Yeah.
they be aware of this. And
Exactly.
then we started doing home care. We visited the homes of people who are suffering from dementia, because the caregivers was in a bad shape. Caregiver burnout was there, exhaustion was there, and they were completely completely exhausted, both mentally, physically, emotionally, and I'm sorry to say financially also.
Absolutely, and I agree with you because caregivers की बात हम बिल्कुल आगे करेंगे. But Dr. Sushma, thank you so much for sharing your personal journey as well as what you've done
Yes.
throughout. I think it's commendable the kind of work that you have done,
Thank
and by realizing that सबसे पहले acceptance and awareness is so important. I'm going to quickly go to Dr. Mahima. Mahima, mental health, right? It's not something as easy as chot lag gayi, somebody coming to you and saying, I have, it's paining and please give me some medicine. It is something which is a journey in itself. पहली बात तो हम लोग मानते ही नहीं कि ये भी कोई हो सकती है, लेकिन जब मानते हैं तो किसी डॉक्टर के पास जाते नहीं है बिकॉज हमें लगता है पागल कहीं लोग हमें. सो व्हाट इज योर एक्सपीरियंस अबाउट द ट्रेंड्स दैट यू हैव सीन in this mental wellness journey?
Yeah, you're absolutely right. Physical health primarily thoda easier because you can see what's happening to the person, right? You catch
That's right.
on fever, cold, cough, symptoms are all noticeable. With mental health, the primary issue that comes across is that you don't get to know. Because
Yeah.
yes, like ma'am said, there's lack of awareness. बहुत ही कम लोगों को पता होगा कि when do they need to even consult a psychologist or a therapist. And even when they do realize, like you said, it's such a big taboo, it's the hush hush word. They don't just want to go to a psychiatrist, a therapist, because they think that, one, we are not on the other side of the spectrum because of the social messaging that has been there, which is a huge, huge impact. I think all over my years as being a therapist and being a founder, being a researcher previously, I've
Yeah.
realized that how we put it across to the other person really matters in how mental health is viewed largely, like by and large. It's as simple as बहुत छोटी छोटी चीजें, but it impacts in how people view mental health. Like
Mm.
when I get patients, or earlier when I used to consult in a government setup, then I've moved to a private setup because the access was to tier 1, tier 2, tier 3 strata of the population. Everyone
Right.
understands mental health differently. And when
हाँ.
people come up to you, they'd say कि मैडम हमारे बच्चे को ऑटिज्म है, ये नहीं बोलेंगे बट बोलेंगे ये ऑटिस्टिक है, इसको देख लो. So
Mm.
the labeling to the child is ये autistic है, not that मेरे बच्चे को autism है, which is different. So you put the condition first and the child next, considering that's how the mentality is. That something's certainly wrong with this person or with my child or with my family member. And now they are labeled by the condition. And that's why, like you said, it's so hard to get through to someone who's actually suffering and tell them that you need help, because then acceptance and digesting that fact becomes really hard.
Mm.
Not also because of social messaging, the
Right.
peer pressure and the comparison that comes in weighs down the person even more. I think ma'am would agree, and even Ankit and me have shared so many experiences earlier in the corporate strata where
Mm.
there's a huge turn down to people who are suffering to just say it out loud that, you know what, I'm not doing well,
Yeah.
because they wouldn't want to say. ये हमारा standard answer है. How are you? Very good. You tell me. Irrespective whether we are very good or not good, this is the byline we are supposed to say. So
Right.
this that's the magic trick. I think Ankit and me have tried it a lot previously with our team outside, but even with my patients, it's so easy to get through. The moment you say how are you and they say yeah, all good, and I'm like, yeah, then why are we even meeting? You
यहाँ
tell
क्यों
me.
आए हो मेरे पास? Exactly. So maybe that is why
And
Ankit,
it
the
breaks down. Yeah.
right. So maybe that is why, Ankit, the application world really works beautifully because many times we are in a state of denial or acceptance or being physically approaching, a doctor in a hospital setup कि भाई मैं वहाँ जाऊँगा मुझे किसी ने देख लिया तो बोला ये तो you know like in Singapore it would be the Institute of Mental Health, right? ये वहाँ क्या करने गया था? Because many times we are so worried about दुनिया हमारे बारे में क्या सोचती है. So Tell me more about your personal journey, which you said that you did kind of face at one point. And in the
Yeah.
corporate world, how do you really manage this? Because there are people who go through mental trauma, through, a lot. And आजकल तो हमारे साथ में ही बहुत लोग काम कर रहे होते हैं who are on the spectrum.
Right.
तो कैसे उनको कोचिंग देते हैं? क्या करते हैं आप?
Right. Yeah. I mean, I'll take a cue from what Mahima just mentioned and, what you just pointed out. In fact, the time jab hum start kar rahe the, hey, which was back in 2020,
Yes.
that was a COVID lockdown tha. And in a very good way, COVID actually helped increase awareness on mental health care.
Right.
It actually propelled people because अब उनको कहीं जाना नहीं था, वो कहीं जा सकते नहीं थे. So a lot of people actually, started taking these therapy sessions over video, over Zoom calls, etc. So it was a very good time, I would say. And in fact, we have seen, when we were actually running Hey, from the time when we'll speak to therapists, become a panelist on our network, they were relatively free. Maybe 50% of their time was free. Or
Yeah.
by the time we almost were kind of pausing work in 2023, all the therapists, their calendars were full, they were running short on time, they had so many people to kind of look up to. So in a very good way, I think COVID really helped increase that awareness regarding mental health care. But
Yeah.
there is definitely, like Mahima was saying, that space which physical health gets. You don't put mental health care at the same level. And also it is because you see, when you are in a family construct or when you are in a friendship, like you're with a group of friends,
Yes.
आपका जो conversation होता है, like what you don't see in front of you, that never gets normalized, right? So if family is never talking about mental health care or emotions or feelings, or your friend circle is mostly not talking about all of these very important topics, right? You're mostly, let's say you're just having a great time, and then you never talk about these sensitive things. So
Yeah.
it never gets normalized that you speak about your struggles or what you're going through. And so it never becomes mainstream. You never go out. You don't feel that it's normalized to actually take help in that space, right?
Yes.
I think in many ways what we did, with Hey, and what I'm doing right now, as a life coach, is basically, we're providing that space. Even the name Hey was like, let's start a conversation, right?
Yeah.
Let's
Yeah.
begin. That was the intention. At least, come over and say hi, and then we'll take it from there.
Yeah. True.
So the idea is ki, just take that first step, say hi, and we'll help you through that journey, right? So for instance, when I'm life coaching, I'm also, my first session, discovery session, is mostly free. It's pro bono. But then it gets the user into the space of speaking out, taking help, becoming vulnerable. So it's a very important first step that we saw is very important. It's very crucial to begin the journey, basically.
Yeah, I agree with that. Dr. Sushma, बड़ी misconceptions रहते हैं कि Alzheimer's dementia बस old age से associated होता है. Do you think that is true, or are we seeing a change in the way it is? Because आप तो day by day you are actually talking to a lot of people who are going through this in some form or the other. So what would you suggest?
Dementia is an umbrella term, and it has various diseases, like Alzheimer's disease is the most common form of dementia. Then there is frontotemporal dementia and dementia with Lewy bodies and vascular dementia.
जी.
And it is not only the memory loss, it is the recent memory loss which we have to explain to the people in our awareness talks, that it is the recent memory loss, lack in thinking, and unable to do your daily tasks. That memory loss is hampering your activities of daily living. So when the life starts becoming a little impossible, don't label it as old age. उसको पापा मत कहिए, उसको एक न्यूरोलॉजिस्ट के पास लेके जाइए और न्यूरोलॉजिस्ट मोस्टली सिम्टम्स को टैकल कर लेते हैं। इसकी इलाज तो कोई निकला नहीं, क्योंकि कारण भी नहीं पता। इट इज जस्ट द अजम्पशंस कि ये होता है, ये प्लैक्स बनते हैं, ये टैंगल्स बनते हैं, एंड उसी के ऊपर रिसर्च चल रही है। और कुछ एक दो दवाइयां भी निकली हैं अमेरिका में, लेकिन उनके साइड इफेक्ट्स बहुत हैं। लेकिन एज महिमा वेरी करेक्टली सेड एंड अंकित ऑल्सो मेंशन कि इन सब चीजों में ना स्टिग्मा बहुत है। हमने भी ये कहा था। वो जब अल्जाइमर्स डिजीज, डिमेंशिया में ये स्टिग्मा आ जाता है ना, तो एक सोशल बैरियर बन जाता है, विच इज अनसीन बैरियर। और लोग धीरे धीरे फिर कटते चले जाते हैं और अपने ही नेस्ट में गुम होते जाते हैं। एंड दैट इज वेयर द रोल ऑफ साइकोलॉजिस्ट, डॉक्टर तो करते ही अपना काम, बट यहाँ पर साइकोलॉजिस्ट आते हैं पेशेंट के लिए नहीं, केयर गिवर्स के लिए, क्योंकि उनको समझ में नहीं आता कि ये हो क्या रहा है और मैं करूं क्या। और जब डॉक्टर के पास आना होता है तब तक तो उनके बिहेवियरल सिम्टम्स सेट इन हो चुके होते हैं। दे आर ऑलरेडी इन लेट थर्ड स्टेज ऑफ डिमेंशिया। तो और अगर शुरू शुरू में आए, अर्ली स्टेजेस में, जैसे रूटीन मेमोरी स्क्रीनिंग ही करा लें जब भी कैंप्स लगते हैं, तो वो मेमोरी स्क्रीनिंग का भी बहुत बड़ा टैबू है।
अच्छा।
If 20-30 people are registered, 10 of them get their memory screening done, but other 20 will say हम तो देखने आए थे क्या हो रहा है, मेरी मेमोरी को क्या हो गया है, कुछ नहीं हुआ। Now that's the taboo which is attached to this memory screening. और ये साथ जो आए होते हैं कहते जी इनकी मेमोरी को कुछ नहीं हुआ, इनको अपना स्कूल भी याद है, इनको अपनी शादी भी याद है, पुराना घर भी याद है,
पुरानी बातें याद है,
बस जॉब भी याद है, अभी खाना क्या खाया भूल जाते हैं और जान के करते हैं, हमारे को तंग करने के लिए करते हैं। यहाँ अगर अवेयरनेस हो तो आप फट से न्यूरोलॉजिस्ट के पास जाएंगे कि रीसेंट मेमोरी लॉस।
करेक्ट।
जिस आदमी ने कभी गाली गलौज ना करा हो, वो अपने वाइफ को गालियां निकालने लग पड़े, तो गो टू द न्यूरोलॉजिस्ट, डोंट बी एंग्री। और अगर उन्होंने किसी को अपना भाई कह दिया है, बेटे को अपना भाई कह दिया है, बूढ़े हो गए हैं, जब देखो मुझे अपना भाई कहते रहते हैं, इनको भाई से ज्यादा प्यार है, मेरे से तो प्यार ही नहीं है, बेटा हूं मैं, इनकी सेवा करता हूँ, एंड दे नेग्लेक्टेड। और अगर अर्ली स्टेज में मेमोरी स्क्रीनिंग करके अगर आप MCI विच इज माइल्ड कॉग्निटिव इम्पेयरमेंट, वहां अगर आप पता चल जाए, आपको डायग्नोस हो जाए, तो बिलीव मी, फ्रैंक डिमेंशिया एंड अल्जाइमर्स डिजीज, इट टेक्स ऑलमोस्ट 15 years टू सेट इन। ये अवेयरनेस नहीं है, इसलिए हम उस स्टेज पे जाते नहीं है, और सोशल स्टिग्मा बहुत है इसके साथ,
बहुत स्ट्रॉन्ग है। सो महिमा, राइट, एंड वी हैव टू डील विद दैट, बिकॉज जब तक हम शेल से बाहर नहीं निकालेंगे लोगों को, वील हैव मोर एंड मोर केसेस। और जैसे डॉक्टर सुषमा बोल रही हैं कि उनको और स्पेस की जरूरत है, बिकॉज पेशेंट्स इतने ज्यादा आते चले जा रहे हैं, इतने ज्यादा लोग सफर कर रहे हैं फ्रॉम अल्जाइमर्स, की जगह और चाहिए, केयर टेकर्स और चाहिए, बहुत ज्यादा रिसोर्सेज की जरूरत पड़ रही है इस टाइम पर। सो महिमा, लेट मी आस्क यू दिस क्वेश्चन कि जब तुम्हारे पास लोग आते हैं विद डिफरेंट काइंड्स ऑफ चैलेंजेस, how do you get them out from the stage of denial to acceptance? What is that cycle like, and what does it take?
It is a process for sure, but I think what I've found is the easiest and the simplest way to get through, jaise aapne kaha, how do I break through, is validation. Like Ankit said, that when we don't speak about things that need to be spoken about, they
Yes.
become the non-normal. And that's how people stop speaking about it and solving for it, because they think ki hamare sath to certainly koi problem hai, like I don't fit in because people around me are certainly far off, like either they are ahead of me, they are better of me, or I don't know. And either or ke case mein, they stop voicing out how they truly feel, because then
Hmm.
they feel that I don't belong. The moment you start to be more receptive and tell them that, yeah, it's okay, like 10 out of 12 people come to me and they say what you're saying to me, and it like immediately settles in and they
Yeah.
start to speak more. So I think empathy and validation, which is a basic human skill, we do nothing with it as therapists. We just bring it to the therapy room and enhance it a little more. The
Hmm.
moment you start to do that, I think people get through, because all they need, and I think Ankit and me utilize that to the maximum even at Hey, is that listening was key. We used it in
Yeah.
the model we developed to care and support the psychological first aid model we built back then,
Yes.
where listening and empathy were at the heart of it. The moment you give someone an ear and you not only hear them out, but you listen to them genuinely with
Hmm.
the intent to care, then they
Yes.
do come out and they start to speak out. I think that's been my biggest learning.
Yeah, absolutely. So, Ankit, हे के साथ में क्या plan है? Because as I see, I was looking at the numbers for Singapore, for example, youth and their connection with technology. Technology की वजह से mental challenges and depression and a lot of suicides as well, the numbers that have been going higher and higher in the youth. And फिर आगे बढ़कर बहुत ज़रूरत पड़ती चली जा रही है with the kind of lifestyle we have. So क्या plan है? How will Hey reach out to the real people out there and start helping? I see so much that your
Oh my
app
God.
can really do. Yeah.
You've touched a very emotional nerve here with me.
High five.
So yeah, I mean, Hey kind of paused work back in December 23. Especially with what goes on with startups, some progress, some kind of have to halt, work. I don't have a very definite answer for Hey per se. On we've kind of paused work, and both me and Mahima, when we were kind of letting go, we were like, we'll see. Like I think at this point in time, there are certain realities for both of us that we need to maybe work towards. So Mahima started with Embrace. I took up a training as a life coach. I'm kind of progressing on that.
Right.
But Hey, we were like, what? I think there will be a time when it all comes together in a more meaningful way. I think personally, I very much feel connected to that space, which I
Right.
kind of started off. So becoming a life coach is my way of like continuing that journey. And you are right. I think within Singapore, and largely a lot of people from India also reach out to me, as well. There is, I think, like I said, there is a growing realization. I see that trend happening where the youth and people at work, they are realizing ki yaar, beyond money there is life. A
Hmm.
lot of people are getting into that space of, what, I can't take this at office. It's not, this is not what I envision for myself. They're taking that break, or they're taking calls, beyond money. Like, I'm okay with a lesser amount of money, but I want a better life. So there are a lot of, I think, these kind of, there are folks who reach out. Some of them are at the cusp of that, of that decision. Ki, kya main isko, what should I do? Like, I don't
Yes.
want all that is going on. And money is important, but not that important. What should I do? So I've had those conversations, right? Where does your values actually lie? What do you really value, money or your, what you want? So I think I'm trying to do it at a more personal level, not with Hey per se, and not at a bigger level. But yeah, I mean, I'm very, like, I see a lot of positive trend towards people making better value choices beyond money
Yeah.
as well. Yeah.
That's so important in today's world. So, Chaliye, that brings us to our question, which is extremely important. Ki bhai, आप तीनों अलग अलग स्पेस पे यू आर स्पेशलाइजिंग, राइट, एंड यू आर लुकिंग एट मेंटल हेल्थ इन अ वेरी वेरी डिफरेंट वे देन मेनी ऑफ अस डू एट दिस पॉइंट ऑफ टाइम। डिनायल की स्टेज से आप आगे निकल चुके हैं, आप रियलिटी की स्टेज पर आ चुके हैं, और आप लोगों को अवेयरनेस दिला के really you are making a change, you are change makers in that concept. So क्या चीज आप एडवाइस के रूप में देंगे, बिकॉज व्हेन आई लुक एट यू, यू हैव चिल्ड्रन, कॉर्पोरेट वर्ल्ड, एडल्ट्स, everybody is covered in this very forum. So आप क्या एडवाइस देंगे लोगों को कि वर्ल्ड मेंटल हेल्थ डे पर, you know, we got to pause, think about mental health in a as serious way as we think of our physical self. वो तो मैं कॉमन मैन होते हुए, कॉमन इंसान होते हुए ऐसा एडवाइस आराम से दे सकती हूँ, बट व्हाट वुड यू गाइस एज स्पेशलिस्ट रियली से टू पीपल आउट देयर? डॉक्टर सुषमा, आप क्या बोलना चाहेंगी आप लोगों को कि कैसे पहचाने कि अर्ली स्टेजेस हैं, क्या करें वो ताकि मेंटल अवेयरनेस हो?
अपने आप को तो इतना पहचानने में नहीं आता है, इट इज द फैमिली विच नोटिसेस द चेंज। अपने
Yeah.
आप तो सिकंदर होता है कि मुझे तो कुछ नहीं है,
कुछ हुआ नहीं है।
जो फैमिली है उसको लगता है कि कुछ चेंजेस हैं, और फैमिली ही डिनाइल में रहती है, फैमिली ही सोशल स्टिग्मा में रहती है, और फैमिली ही डॉक्टर के पास जाने में बहुत लेट कर देते हैं। बट यहाँ पर मैं कहना चाहूंगी सबसे पहले कि अगर आपको कुछ भी अपने पेरेंट्स या स्पाउसेस के अंदर कहीं भी आपको बिहेवियरल चेंज या मेमोरी चेंज नजर आए, प्लीज डोंट हेसिटेट in contacting a neurologist. And मैं तो अपने सब केयर गिवर्स को I refer them to a psychologist to take that stigma and how to take that burden, burnout रहता है, it is such a big burden of love कि उसको आप उतार के फेंक भी नहीं सकते कि पोटली उठाई और फेंक दी। तो आई advise them to visit a psychologist who is on our panel and she gives them therapy. बहुत अच्छी थेरेपिस्ट है जिससे वो और ज्यादा अपने आप को एम्पावर करते हैं केयर करने के लिए, बिकॉज केयर फॉर दोज हु वंस टुक केयर ऑफ अस, आई थिंक दैट्स द बिगेस्ट ऑनर ऑफ दिस यूनिवर्स। लेकिन हमें अपनी भी तो केयर करनी है ना, उसके लिए हमारे पास जैसे महिमा है, अंकित है, तो वी हैव पीपल अराउंड अस, द ओनली थिंग इज दैट वी नीड टू अप्रोच देम। अपने आप को ओपन अप करिए कि मुझे ये स्ट्रेस हो रहा है, मेरे फादर को डिमेंशिया है, और उस स्ट्रेस को एक्सेप्ट करिए और आइए आगे। And don't put yourself and shy away behind the door. Come out, because happiness needs no people, no age. It just needs people. And you need to be not shy away from your dementia family member. Bring them out. कि मेरे फादर हैं भाई, अगर भूल जाते हैं, थोड़ा सा स्टम्बल करते हैं, पार्किंसंस है उनको, तो कोई बात नहीं, दैट डजंट मीन कि आप उनको बाहर ले जाना छोड़ देंगे। बी एन असिस्टेंट। और सिमिलरली ऑन द अदर साइड ऑफ द फेंस, बाकी लोग जो देख रहे हैं, दे शुड एक्सेप्ट इट, एंड उस बच्चे को, उस स्पाउस को शाबाशी देनी चाहिए। That way we will be able to make a very beautiful, loving, dementia-friendly community, and we should all accept it as a social problem, and accept it and fight with it.
बिल्कुल, thank you for that. I have a question, महिमा, आप शायद इसको आंसर कर पाएंगे कि यहाँ कोई मुझसे लिख के पूछा, बोले नाम नहीं बोलना हमारा। See, this is what we mean when we are talking about something. बड़ा ही अच्छा सवाल है। I would say वो पूछ रहे हैं कि हम ऐसा कैसे चेक करें that we are okay or not. So how should we take care of our own mental health, and how do we make sure that we are doing okay? Because there are moments, that everybody falls. there are moments
Yeah,
when we feel
absolutely.
कि ये हमारी हार्ट बीट बढ़ रही है या हमारे को कुछ ऐसी फीलिंग हो रही है that
Mm,
can't
mm,
handle life. So how do we
mm.
know that we are okay, and how do we take care of our mental health?
So I think just moment where you realize that, vulnerability has to do with strength, and it is
Yes.
okay if I'm having a bad day, but it's crucial and imperative that I recognize that things are falling off for me. And these can be as simple as कि आज ऑफिस जाने का दिल नहीं है और अब ऐसा हफ्ते में 4 बार हो रहा है, और I don't feel like getting up from my bed. I don't feel like eating the things I enjoyed earlier.
Hmm.
Or, with my spouse, I don't feel the same spark I used to feel earlier. There's something gone amiss. If there are these simple things that you're noticing, there is no harm in just speaking with a psychologist, because it's not for the mentally sick. Like,
Hmm.
because people confuse it that you have to visit and take help jabki aap suffer kar rahe hain. But
जी.
mental health and therapy is for everyone. Like, I've been in therapy and I have no shame about saying that, because it's only human to take help when you're feeling not at your best, and
Yeah.
addressing it in time before it goes too far off. So, the moment you think that mental health is a character flaw, then it
Hmm.
becomes a problem. You have to understand and acknowledge that it is circumstantial, it's situational, and sometimes it's not in your favor to control a lot in the situation. So it's okay to also let go and take help at the right time, because like Dr. Sushma said, and Ankit also said, that if you catch up in time, there's so much and more you can do with yourselves and
Yeah.
be the like the best version of yourself, maybe better than how you were earlier. But it's only if we lose out on time that we do more damage than we know we are doing to ourselves. So I think that's the only message I'd like to give. If you see little red signs coming up, then don't shy away of consulting just for the need of clarifying ki, do I need help with myself? Because at large we don't know that is something going wrong. But if you feel like I'm not feeling like myself, like there is
हाँ.
something which is amiss, then it's the right time to speak to a professional.
राइट, सो
Yeah.
दैट इट्स अ परफेक्ट आंसर. सो अगर आपको थोड़ा-सा भी लग रहा है कि आप पहले जैसे नहीं रहे, या बाकी लोग आपको आके बोलते हैं कि आप पहले जैसे नहीं रहे, नॉट द यूजुअल हस्बैंड वाइफ, हाँ, कि वो तो सभी कहते हैं एक-दूसरे को, बट दैट्स नॉट
Yeah.
द बिट वी आर टॉकिंग अबाउट. वी आर टॉकिंग अबाउट आप पहले जैसे नहीं रहे, यू आर फीलिंग दैट. व्हाई यू नॉट एन्जॉयिंग द थिंग्स यू यूज्ड टू एन्जॉय, राइट? व्हाई आर यू नॉट
Yeah.
लाफिंग एज़ मच? व्हाई आर यू नॉट बीइंग
Yeah.
as energized as you were earlier? तो फिर it is time to step back, introspect,
Mm.
and maybe you need help.
Yeah.
अंकित एक लाइफ कोच हैं और अंकित बहुत ही पेशेंट हैं क्योंकि लाइफ कोच उसको होना पड़ता है, and that's how he's even here, very patient and very quiet. Ankit, आपके pearls of wisdom क्या हैं for people out there, because you have a lot of experience with people, what kind of mental challenges they go through, right? What would you like to say?
I think first of all, because actually हमारा जो panel है, which is very diverse, right? So me as a life coach, Mahima as a clinical psychologist, and Dr. Sushma who's working on dementia. I think एक first of all जो मैं बहुत time से actually मैं चाहता था ये बोलना कि mental health actually it's kind of like a it's kind of like a journey. It's also like from it can be from very severely impacted like the case in dementia,
Yes.
or it can be a very day-to-day thing as well, right? So it's actually a curve on which you actually sit on a day-to-day basis, like as anybody, like even me, you, or anybody for that instance, right? So looking at mental health as a keyword, my mental health is bad, and just relating it to a very severe, that's what happens. That's what you start envisioning in your head कि यार जैसे आपने explain किया पागल, I hardly use that word. I feel very very
Yeah, exactly. Yeah.
it just does something to me. So it's like a curve. Like it can be a very day-to-day thing that you do with your friends, with your wife, with your kid, etc. And you might be getting impacted. So to give you a very small example, there was a time when I used to, like, my daughter used to talk to me, and then I used to get really frustrated. Yeah, I used to lose temper in replying to her. Like, if there is incessant questioning, I used to lose temper. And then I stopped and like really looked at myself. Ki, why is it happening? Right. And so I realized that, beyond maybe 9 p.m., 10 p.m., when I've gone through the day, I feel really stressed and I'm not able to answer. So,
Yeah.
so that's also mental health concern for me at a very small level, on a very day-to-day level, right? So I worked on it. Ki, I would speak to my daughter, ki, please, this time, let's have some fun. Let's not get into so much questioning. So you have to find ways around it, right, to solve for it. So ये एक ऐसा curve है which can happen on a day to day, or which can also become a little bit more pronounced if you don't really look at it, right? So my advice, I mean, wouldn't say advice, but it's something that I also follow, is that I think at your own level, keep observing things that trigger you, right? Anything that triggers you is one such thing which is having an impact on your mental health, right? Like the instance that I gave about my daughter asking me constantly at that point in time,
Yes.
9 p.m., 10 p.m., right? Or let's say your boss says something and you get really agitated. That's a trigger. Or your friends suddenly remark something and that gets you agitated. That's a trigger.
Yeah.
And find why are these things triggering you, because most of the times these are the things which are actually subconsciously they are impacting you somewhere, which you have not involved. So I kind of follow this myself, and it's a very, like, I find it a very good way of trying to really get better, keep resolving things on a day-to-day basis
Yeah.
to become better. So yeah, I mean, just be very, like, take a step back,
Yeah.
look at yourself, look at your triggers, and just look at it from a growth perspective, not really ki mere paas ye meri problem hai, but really look at it, okay, this is one problem, if I solve it, I'm a bit better than what I
Yeah.
was a day before. So yeah, just that.
That's amazing. So you can be a better version of yourself every day by controlling your mind. And
Yeah.
definitely the things that irritate us, usko पहचानिए, अपने में बदलाव note कीजिए, and if you need help, go and ask. If your family member you believe is going through something and obviously they are not able to realize it, then you have to also accept that they need help and you need got to help them. I mean, अभी मैंने शुरू में वो पागल है वाला लूजली जैसे यूज करते हैं, आई थिंक पीपल हु वर्क इन द मेंटल हेल्थ स्पेस, या वो लोग जो पर्सनली एक जर्नी के थ्रू गुजरे हों, जैसे कि हम लोग बड़ा आराम से फ्रेंड्स में बैठे होते हैं और किसी को कुछ याद नहीं आता तो बोले डिमेंशिया है क्या तेरे को, क्यों नहीं याद आता, वी जस्ट से इट सो लूजली. लेकिन when I step back and I think, oh, my father went through that, and I observed day by day the way what he was to what he became at that stage. मुझे गुस्सा आता है when somebody talks so loosely about dementia है यार, इसको तो dementia है, because you don't realize what you are saying. Only people who have gone through that journey or know more about it, they realize. So I find myself actually getting angry and saying something to those people. Please don't talk like that. And then they think I'm being, because I'm being sensitive because of my father. But the reality is that I am sensitive to anybody out there who's going through something like that. I'm a part of Dr. Sushma's WhatsApp group, which I tell you is hats off to her कि वो इतने अच्छे से सबको हेल्प करती हैं कि कोई भी उस ग्रुप को ज्वाइन करता है, उसमें केयर टेकर्स होते हैं, ज्यादा केयर गिवर्स जो होते हैं, एंड उनकी कोई भी प्रॉब्लम हो, she is so patient in the way she suggests म्यूजिक सुनाओ, उनको प्यार से खिलाओ, उनको पुरानी बातें याद मत कराने की कोशिश करो, डोंट मेक देम फील उनका कॉन्फिडेंस लूज होगा if they can't remember. I read that all the time, but hats off to that because you guys are doing amazing work. Thank you for that.
Thank you
By the
so
way,
much.
the people who go through therapy also have something to say about the people who don't go through therapy.
Yes.
I'm sure.
Yes.
Yeah.
They do. They do.
Like, everybody who goes through therapy is like, why don't you go through therapy?
Yes. Yes.
Everybody needs
Well,
therapy.
Earlier, we used to have all these therapies at home.
Yes.
Such large
Yeah.
family. Dadi bhi hai, pardadi bhi hai, chachi bhi hai. So you just
That's
cling
so
on
right.
to the favorite ones
Ha.
and just
Yeah.
leave the other ones who were not favorite and just go out and enjoy yourself. We don't have any cushions now because of the
Exactly.
nuclear
So
families.
right.
And people are moving out, and the caregivers and the patients, both, they are all left alone. And basically, we need to be, as Renuka said, that we need to be sensitive towards elders and don't make fun of forgetfulness.
Yeah.
जस्ट डोंट के अब इनकी तो बात मत करो, ये तो सठिया गए हैं, ऐसे नहीं बोलिए. अगर वो
60 is the new 40. 60 is the new 40. अभी सठिया नहीं, अभी पता नहीं क्या बोलना चाहिए, बिकॉज 60 के तो नाच रहे हैं आजकल सुषमा जी, मतलब आप
नहीं, लेकिन लोग कह देते हैं, लोग कह
Yeah.
देते हैं, क्योंकि देखो कहीं ना कहीं ब्रेन श्रिंक करता है एज के साथ साथ, और
Yeah.
कहीं ना कहीं छोटे छोटे मेमोरी लैप्सेस आते हैं, तो या रेपिटेशंस आती हैं, तो उसमें आपको एकदम से या ना उसका मजाक नहीं उड़ाना चाहिए, और ना एज रेणुका सेड ये कहता है अपना इलाज करा, तेरे को तो डिमेंशिया हो गया.
Exactly.
ऐसे तेरे को या मेरे को ऐसे कभी नहीं कहना चाहिए, बिकॉज यू डोंट इवन नो what a road of a caregiver in dementia illness is.
Yeah.
It is a very hard, up and down, very difficult road. So don't ever say that to anybody or to yourself. And keep
Absolutely.
challenging your brain. Keep meeting, keep socializing, and you'll be happy.
Actually, very true. Yeah. Just do not say that to anybody, because you never know when it falls on you and you don't know how to get out of it. Really.
Yes.
So
yes.
अपने close लोगों को to go through that, to see them go through a phase, it's heart breaking, really.
Heart-
And then, of course, what they are going through, उनको तो पता भी नहीं होता. But that's about Alzheimer's, any kind of mental illness. So thank you so much, Ankit, and thank you, Dr. Mahima. Thank you, Dr. Sushma.
Thank you.
This is a little work that we do towards creating awareness and kind of making sure that World Mental Day पर ही नहीं, but otherwise भी हम ये याद रखें
Yes.
कि हमारा जो it's okay to take a break and prioritize sometimes our mental health. Right.
Absolutely. Thank you
Thank
so
you.
much. Thanks for the opportunity. This was amazing.
Thank you.
Thank you.
Thanks
Nice
a lot.
meeting you, Ankit and Mahima.
Same here.
And
Lovely meeting you.
thank you very much, Renuka, for organizing such a lively meet.
Thank
Thank
you
you so
very
much.
much. You
Wonderful,
guys take
yeah.
care. Stay safe physically and mentally. Sleep it.
Yes. Stay